everyone. Thank you so much for joining on Saturday afternoon. This is a session of APPNA Canada Advocacy Committee. We are having a series of sessions, and this is our today's session is with APPNA Merit. I'm Dr. Fiza Rafiq. I am a family physician working in Calgary, Alberta, and I'm the clinical assistant professor with Cummings School of Medicine. I'm a past president of Fatma Jinnah Medical Alumni Association of North America and currently working as the chair of APPNA Canada Advocacy Committee. This year, we started a series of sessions to highlight the work of various APNA committees. Today is our third session, and this session is with a very important committee of APNA, which is APNA Merit. Merit stands for Medical Education, Research, Innovation, and Transfer of Knowledge, is one of the educational committees of APNA with over 75 members across different subspecialties and work groups. The goal of APNA Merit is to empowering medical knowledge and quality of healthcare in Pakistan. I had the privilege and honor to work with two subcommittees of APNA Merit. One is APNA HIV Committee, and the other is Family Medicine Committee. Both these committees have been working very hard. I know many physicians who are providing mentorship opportunities to physicians, not only in Pakistan, but also in North America. So a great platform for students, for physicians, as well as for all those who want to get in, providing mentorship and want to teach physicians across the world and in Pakistan as well. Um, I have the chairs of APNA merit committees with us, Dr. Sadiq Naveed and Dr. Saad Usmani. Thank you for joining us and giving us your precious time. My co-host today with me is Dr. Tahreem Irfan. She is working in British Columbia. She's a graduate of Rawalpindi Medical University, and currently she's working with the research subcommittee of APNA BC chapter. She's a co-lead for the research committee with APNA BC chapter. So over to you, Tahreem Irfan.
Thank you, Fiza, for the intro. And let me now first introduce Dr. Sadiq Naveed. And I really feel a true pleasure to introduce Dr. Sadiq, who is a respected leader in psychiatry and a passionate advocate of empowering the next generation of psychiatrists and maybe some other physicians as well. Dr. Naveed currently he serves as psychiatry program director at Eastern Connecticut Health Network. In addition to his clinical leadership role, Dr. Naveed has held several prominent positions within the medical community. As a strong supporter of mentorship and professional development, Dr. Naveed chairs the APNA Young Physicians Committee, which is one of the organization's most dynamic committee. He also serves as the co-chair of APPNA Merit Research Subcommittee and is an active member of APPNA Merit Psychiatry Subcommittee and is currently serving on the APPNA Nomination and Election Committee. Please join me in warmly welcoming Dr. Sadiq Naveed today.
Thank you. So can I start with my PowerPoint? Okay. So thank you very much for inviting me here, and I see some familiar faces, some new faces. It's great to be in APNA family. I joined APNA probably in 2015-16. I have served as APNA YPC chair in 2022. I was NEC member in 23, I believe, if I'm not getting old and if I'm not forgetting. And this year I'm serving as chair of APNA Merit. My son just entered into the room, so if you see, loud noise, it's him. I will briefly share about, what APNA Merit is doing and introduce, APNA Merit to you, all of you. All the educational subcommittees of APNA are doing phenomenal job, and we can certainly build on that. And when I talk about educational committees, that include APNA YPC, APNA RESA committee, and APNA Merit committee. And certainly we can be doing more. So let me start with, and I also have Dr. Saad Usmani, and he is probably going to get an introduction. I'll quickly breeze through this PowerPoint. So this is the QRS code for APNA Merit Academy. So I just want you to take out your phone and just scan this QRS code. and go to APPNA Merit Academy and see what is the content there. As Dr. Fiza Rafiq mentioned, that Merit stands for Medical Education, Research, Innovation, and Transfer of Knowledge. Our focus is on improving medical education, research, and clinical structures back home in Pakistan, while RISA helps with similar mandate in the United States. We have been engaged in developing different educational programs. So this is our mandate as per bylaws. A little bit historical background. Merit started as a task force in 2006. Dr. Nahid Usmani, who is also past president of APPNA, was the founding chair of Merit, and Dr. Shahid Rafiq, who still helps Merit in many ways, was the founding member. And Merit became a committee in 2007. And in 2008, they started to work on APPNA visiting faculty. And then under APPNA visiting faculty, they created different specialty specific networks in 2008. And then in 2009, at that time, when COVID was not here, they were thinking about e-teaching initiative. And I just remember that there was a series of psychiatry webinars that happened, and I participated in that in 2014 or 2015. Dr. Baba Rao became the chair, who's the president-elect of APPNA at this time. He restructured those lecture series and started them again. And along with him, Dr. Shahid Rafiq was the chair. And these are our committee members. So Saad Usmani, he also chairs APPNA Merit with me, and we have a list of APPNA members who serve as the member of Merit Committee. In terms of impact, so I think a lot of time we do talk about what APPNA does, and in many people's mind, APPNA is more vested towards politics. But just look at the impact just last year, 2024, APPNA contributed about 3,000 educational hours. And these were based on different course developments, webinars, and all of the educational series that we are doing. Out of those 3,000 hours, about 150 hours were live sessions. And in those live sessions, about 500 learners joined back home from Pakistan. And these 5,000 people, most of them, I would say about 90-95% were from Pakistan. There were some across the globe too. So we are helping improve the knowledge. And I was looking at some outcome measures based on the courses that we are doing, and most of them were scoring after this course, after certain courses which had quizzes, they were scoring more than 90%. So they were getting something out of this. So this is live sessions for on-demand learning. So if you click the QRS code, you go there, we have different courses there, and you can go and register for a course, or you can listen to a previous webinar that's on our YouTube channel. So we had contributed about 2,800 learning hours. That's enormous for APPNA to contribute 2,800 hours in a year. So just remember, there are 365 days, so how much you can do. And there were about 498 learners. These are unique learners. They are not people who listen to something else. And so these are unique learners. They were part of those sessions. In terms of how much, we talk about our social welfare disaster committee and how much charity work they are doing in terms of, educational subsidization. And these are very conservative numbers. I think I took like $10 per hour, but if you look into any CME session, it's going to cost you roughly about $30 to $50 per hour. But because we don't provide CME, so I lowered the cost. I took, I think, $10 to $15 per hour. We subsidize $150,000 in terms of educational investment to people back home. And just remember, we charge very little. And yes, it is a lot for someone in Pakistan because of currency depreciation, but we want them to learn, and we reduced the cost of our courses after the currency depreciation, but we still subsidize 150 according to very conservative numbers. If you want to probably take more liberal number, it will go to about $500,000 dollars just in a year. And these are more details. These are our revenues that are coming from courses. So if you see from 2021 to until March 28th, our revenue is going up. And just last year we had revenue of $34,000. And this year so far we have, I think, about $21,000. We take care of all of our costs by ourselves. We have merit coordinators. So let's say if you are an expert and you want to do a course on epilepsy, you develop a course, we will provide you all the administrative support. So you bring the faculty members. So I remember, right now I'm working with some faculty member to develop a course on geriatric medicine. And what they have to do is that they have to develop the course. In that sense, they have to choose the topics and the speakers. And then it will be created by our merit coordinators on the Think Effect platform. They will do the Zoom registration. They will do the flyers. Your job is just to find a speaker, design the course, and then deliver on the day. So we do help in that part too. There are different courses that are available, on Merit Academy website. So for example, psychiatry, under psychiatry, we have done child and adolescent psychiatry course. We have done general psychiatry course. We have done addiction, geriatric psychiatry. And this year we also going to do addiction medicine. So in US, you need 8 hours of CME sessions, CME hours for a DA renewal, which is for control members as a membership benefit. We are currently doing a HIV course. Our neurology team really does a great job on stroke fellowship, which has been recognized across the globe. And then just before I started the session, we were doing a webinar on suicide screening, intervention, and prevention. And we just started a group from there. From this webinar, we have, I think, around 75 people who just joined. So this is the impact of the work. For webinars, we have ongoing research symposium. We published in 5 years in a row about the research landscape in Pakistan. So we invite speakers from across the globe. Dr. Sayyid Uzair Ghani, who is also from Canada. He leads that effort. He invites the researchers from Pakistan, sort of do like a SWOT analysis and go through that. BLS and ACLS courses that are currently going on. Under Dr. Usmani, we are doing a Merit Hem-Onc series right now, which is currently active. My future goals are that I can build sort of APPNA Speakers Bureau. So let's say if Dr. Fiza Rafiq is traveling to Pakistan and she's available and someone wants her to give a talk on a topic, then she can give a talk. And how we'll operate that is we'll create a listserv. Someone will reach out to us. We'll send an email through the listserv to speakers and see who is traveling to Pakistan and who can give that session. I think it is really helpful in that sense that you go there, you meet people, networking, but also for early career physicians and mid-career physicians who are into educational world, academics that can help with promotion and tenure too. I talked about APPNA Merit Academy membership resources. All APPNA courses, I think up till 2024 are free for APPNA membership, and addiction medicine courses also going to be free for APPNA membership. We are slowly collaborating with specialty networks. So I'm in talk with APPNA, which is Cardiology Network, and hopefully we'll develop a course with cardiology colleagues. We are working on a course with psychiatry colleagues, with Saad by being a hem-onc physician. They have already started the work. And then, my hope is that we can take it to the next level and we can continue to talk with stakeholders in Pakistan. This is, if you go to APPNA membership portal, this shows on the membership dashboard. There's a coupon code, so you can just insert there and, then you can have free access to code. I think this is my last slide. I will stop here. Thank you very much.
Thank you, Dr. Naveed, for a quick overview of APPNA and APPNA Merit. And if anyone has a question, we can ask Dr. Sadiq now, or we can wait at the end for asking the questions from both of them.
I have a question. Can you hear me?
Yeah, please go ahead.
Okay. Dr. Sadiq, you're doing a wonderful job. Normally people would not be able to imagine what kind of work's being put in and what benefits people are achieving from it. But my question to you is, do you do any interactive sessions? Because through all the years of my teaching initially at the Dalhousie University Graduate Center and with the McMaster University, I have found that the interactive sessions seem to be the most useful for practicing physicians. Also, it keeps the momentum going, keeps the interest alive during the sessions. So have you had a chance to think about that, or have you been doing it and I've just missed it?
Yeah, so my son is in the background too. So maybe I can answer this question, and I think Dr. Sadhu Usmani has a meeting, so we can probably let him talk. So what is happening is that we are doing a lot of these sessions through virtual means. So for example, our suicide webinar that we attended, there were participants. It was a live discussion and question and answer session. And similar things when we develop courses, for example, when we develop the psychiatry courses, we do like, let's say 20-30 minutes of presentation, and then there is a question answer session. This is not to the extent of interactive session that we hope for, which can happen in a live classroom, probably the best. And that would probably happen with APPNA Speakers Bureau when they will visit Pakistan. This year, Dr. Saad Usmani is the CME chair for winter meeting. So we are gonna take some specialty workshops in Pakistan as part of the winter meeting. So hopefully that would be another opportunity to provide more interactive sessions. Thank you for the question.
Let's move on, as Dr. Saad has some other commitments as well, and we can leave the questions at the end if that's okay with everyone.
Dr. Tareem, this is Saad Usmani. I'm happy to provide my own brief introduction in the interest of time, if that's okay. And
Absolutely.
just share.
I'm really honored, and I was looking at your.
All right. Yeah.
So please, yeah.
No, so I just wanted to provide my background. I'm a graduate of Salam Iqbal Medical College, and I've served as the APPNA president about 8-9 years ago, and I was active with APPNA Merit from back when I was a fellow, and it's really amazing to see what this platform has become, and for all the wonderful work that people like Sadiq have really done to make this success. And I only see this platform growing. I think in many ways the pandemic actually helped in creating an impetus to grow this platform and have more online virtual content. And and Sadiq again has really helped in promoting this. APPNA Merit Academy is doing a wonderful job. I think the idea of having a faculty speakers bureau is wonderful, and it is going to grow in terms of subspecialties. And we would welcome the opportunity to continue to work with you guys. And I have this overlap as co-chair with Sadiq because he did a wonderful job last year, and he continued to do it this year. And I hope I can continue and grow the platform when I continue this role next year. So I'm here as a resource, as is Sadiq. We're happy to answer questions. I just happen to be 6 hours ahead of you guys in Germany at a conference, and I had to step away from a faculty dinner. So I may stay on for a few more minutes, but Sadiq is more than capable of answering any questions, and he will speak for both of us.
Thank you so much, Dr. Usmani, for joining us from Germany. That's great. And thank you for giving us your precious time as well. And thank you for giving your short intro. We, both me and Tareem last night were looking at your bio, and we were like, how are we going to explain this long 2 3 page work you have done so far? Is amazing and quite inspiring as well. So thank you, and thank you for your time. So we can have some question answer session. If anyone has any question, please write in the chat box. We are happy to take your questions, and Dr. Sadiq Naveed is with us to answer those questions. I see Dr. Saima Abbas has written a question or suggestion in the chat box. Dr. Saima Abbas is also a graduate of Fatma Jinnah Medical University, and she's working with HIV committee with Dr. Fizat Gilani these days, and I'm very honored to have her with us right now. She's writing that we desperately need infection control in Pakistan. Also, can we create an independent group like Jasho that offers quality control metrics?
Yeah, thank you, Dr. Saima Abbas. I just recognized the name from for your conversation and comments on HIV group. Thank you for what you're doing in HIV group. Last year, we and this is all gonna, be a successive, slowly building up on the work that previous committees have done. So I think, slowly we are going towards that track where we can have more impact on policy back home. This is my hope that that's what we do. In APPNA Merit Academy, APPNA Academy becomes more like a course head of APPNA can have a separate wing, but we also do some policy work back home. So recently I've been thinking about, maybe on educational side, because this is my strength on educational side, if we can contribute back home. There has been appetite, there has been discussions on the topic of creating something like JACO, who can provide, who can measure for quality control metrics. In next, I see it happening in next 2 to 3 years. I think we are slowly building the momentum. So, last year we focused more on the courses and creating revenues and making matters sustainable. This year we're going to add like one more layer to that. We're going to add a specialty network and merit workshop and then I have started to have discussions with some of the well-connected leaders within APNA. How can we connect to some folks back home and start leveraging those relationships? Because from your work in HIV and frustration in that HIV group, that there can be hurdles and impact on having an impact in policy back home. So we have to leverage some of those relationships. I think we are on a good path. This is a nice suggestion, and this is something that has been on my mind. And we're going to continue to explore those avenues pretty soon.
We have another
Thank
question.
you. Yes. Who's that?
No, Fiza, there was another question in the chat box from Dr.
Yeah.
Nina.
Just touching base on the previous one with HIV committee and infection control. I mean, I know I've been that with that committee for the past few years, and we have struggles because of the stigma associated with it. And Simon, Dr. Fizaj Gilani, and all others are working so hard. And we have, a list of physicians from Pakistan who are in that group as well. So I think APNA Merit is a great platform. If we can connect with different alumni associations in APNA and can create a kind of, a portal where everybody can get involved in their own alumni through APNA Merit, HIV committee, and APNA Merit, that will be a great platform to get involved and create this awareness that this committee is doing. That's just a suggestion from my side. Yes, next question, Tahreem.
Next question is from Dr. Nadeem Mazhar, who is working as a psychiatrist in Ontario, is regarding, can an APNA membership in Canada contribute to online sessions? And if so, what would be the process?
So I think for I'm just writing my emails too. So I think if you're interested, obviously, you are as much as APNA member as I am APNA member. And, we appreciate you staying connected with APNA despite, Canada not getting that much recognition in the APNA. So please reach out to me. I shared my personal email address. I shared, APNA Merit's email address. If you're interested in creating a course, let's have a discussion and see how can we do that. It would also be helpful, to talk to, let's say, if you're a cardiologist or if you're a gastroenterologist or if you're a primary care physician, and reaching out to your specialty networks and having a collaborative effort. I think if we do it as a team, as a collaborative in a collaborative manner, it will energize more people. But I'm all open to having more courses. I'm hoping that in next 3 to 4 years we can have APPNA Merit equivalent to Coursera of APPNA, where there's a lot of educational content that is there.
Uh, Thank you, Dr. Naveed, and Dr. Nadeem. Thank you for joining us. Just to clarify, APPNA is for everyone, regardless we are in USA or Canada. We are all members of APPNA, and this is the whole purpose of creating this awareness series, so that we all can get involved with Central APPNA, regardless where we are in USA or Canada. We all are APPNA members, and everyone can get involved with Canadian, whether you're Canadian or USA physicians. We can get involved with these committees of APNA, and we can enhance the work of APNA Merit. If you're a mentor, you want to teach, you want to provide some teaching opportunities or skills, want to share your knowledge and skills, please join these committees, regardless of wherever you are in Canada or America. So thank you so much.
And just to add to that, just an additional benefits. A lot of time we ask about what APNA gave, what APNA gives us back. I think it gives us back in so many ways. So, when I became associate professor, I shared a lot of my work in my application that I did under APNA. And when you design a course, you can become a director for the course. You can have a younger faculty member and sort of guide and mentor that person, make a co-director for that course. So that all of this also helps in career growth and promotion and tenure.
There is another question, and I think that could be something Dr. Nadeem can think of. There is a Youth APPNA member, Midha Khan, and she's asking about what are the steps of enrolling in a psychiatric education webinar and courses in Canada.
So if you go to APPNA Academy, those courses, if you are APPNA member, go to your membership portal, you have a code. So there are some psychiatry courses who are available for free to APPNA membership. If I can share my screen again, I will just show you, we'll give you a live demonstration. This is APPNA Academy. It is academy.apna.org. So if you go to courses, and there are a lot of courses, we are slowly building the content. If you go to courses, click on psychiatry. Here are all the psychiatry courses. Some of them have a cost attached to them. So just if you go there, then you can register for those courses from there. So it's super easy. If you have any issues, reach out to APPNA Merit through appnamerit@gmail.com, and certainly we'll walk you through the steps.
Thank you, Dr. Sadiq.
So
Ji,
if you're waiting for me, I stop talking.
okay, so I think Tahrim may be muted now. There's another question in the chat box from Sundar Sabur. Can you provide information about your projects based on levels? For example, for medical students, faculty in Pakistan, USA, residents, MPH, PhD, and what are some of the ways the projects can be more um, participatory, feedback-based innovations in the current project?
Yeah, so there, I think there are multiple things that I want to answer in this question. First of all, the merit mandate is to work with folks back home, and most of the healthcare issues in Pakistan are tackled by primary care physicians. So when we create courses at this time, and when course director asks me what's my target audience, I tell them maybe should focus on primary care physicians and provide them that much detail of information, because not everyone's going to have privilege of being seeing a psychiatrist. So just keep that target audience in the mind when you are doing that. Our focus is on mostly on the medical providers, so that can include the residents, that can include the primary care physicians. We are doing a merit webinar, which includes more advanced level education, so that may also help some HEMONC fellows too. So it can vary depending on the course too. Now, in terms of feedback, I think this is something we are learning. So one thing that we did was, so we do pre and post tests. When with some faculty, we do use the case-based scenarios. For feedback, I think we have not advanced that much because it's still on learning, more like on a demand. So we have started to add some quiz just to test the knowledge of it. So we in this way they do get some feedback, and I earlier shared that most participants do a really great job, and they do 100% complete the course for 100% and take the post-test quiz. They do a great job. Over to you.
Thank you so much. I think there was another question which has been deleted now. If anyone has any other question, please write in the chat box. So my question, Dr. Naveed, is to you is how is APPNA Merit collaborating with other organizations to enhance the work of Merit in research?
So in research, we have a research subcommittee which is led by Dr. Sayed Uzair Ghani. So last year, there was a nonprofit organization, BMY. So we did collaborate with them. We did create a Pakistan clinical research landscape report that looked at this. We in this, and when we are doing that, there are different stakeholders at different institutions that are coming to that webinar. If you go to APPNA YouTube channel, just look at the research playlist. It'll tell you we do engage uh, researchers across Pakistan, and they usually come to those webinars. More on the educational side, we just added few things. Previously, under that research lent webinars, we did cover some topics like quality improvement project, manuscript writing, and then there was another one that is skipping my mind, but we also did a data analysis course last year on the research element. I'm also,
Sir, Assalamu alaikum. Sir, you have done wonderful webinars on.
Okay. I'm also in conversation, and I'm going to have this conversation with some other merit committees to uh, provide some grants for young researchers in Pakistan. So for those, we can probably pick like 10 to 15 researchers for folks who are in medical school or at the training level, provide some grants to them. So we can either pair mentors from here with them or from Pakistan. So this would in a way create an interest in folks back home.
I see a question from Dr. Naseem Ahmed. Please consider creating observation elective opportunities for students. And I think I'm speaking the mind of many parents here as well, and many students. I think one or two students have also joined this session today. And you might be getting this all the time from not only from students, but also from international medical graduates coming from Pakistan to USA and Canada, that they need these opportunities to get involved in research. And I have not personally have not got any resources available for these students and international medical graduates, and I'm sure many other mentors in this group are also struggling to find those resources. So anything that can be done by APPNA Merit, or if APPNA Merit is already doing that, we are not aware of it. Can you please guide us and provide us with some guidance about that?
Yes. So I think, when it comes to creating elective and observership opportunities, so I'm gonna sort of deflect that to YPC, and then I'm gonna wear my past chair YPC hat, and I will answer that question. So in merit, in APPNA there are different committees. They have a mandate, so they have to work under that mandate. So this is something that comes under YPC merit, YPC domain. Now let me answer that question. Wear that hat of past chair, so you don't feel like I'm deflecting that answer. I'm not, taking on that answer. I don't know about the Canada part, but on the US part, what is going on is that, for electives, we have, paid and unpaid electives. Most of the unpaid electives, they happen through VSLO. If you don't know about VSLO, VSLO is visiting student learning opportunities. So even US grads, when they're applying for electives in third year and fourth year, so mostly fourth year, they go through VSLO, they apply at certain schools. Unfortunately, that VSLO is closed since the pandemic. So even for my medical school, I wanted to get it enrolled in VSLO, but it has been closed since then. And they're gonna open up probably when I would be 60 years old. So once hopefully it open up, then we can get some medical schools from Pakistan enrolled in that through for the electives. So for the VSLO, most of the non-paid opportunities happen through them. Aga Khan is probably the only one who is in the VSLO, so their students get the opportunities to do electives. Other institutions, they do electives, but only I think Cleveland and Mayo has free electives, Mayo Clinic, but others have where you have to pay for the cost. So electives are different. Observerships, YPC in last couple of years have started to create observership opportunities. I think last year is their data, they have provided up to 400 observership opportunities. This year, they are trying to go for even higher number. But remember, this all comes from the preceptors, right? So if they don't have preceptors, they cannot provide observership opportunities. This year, just to give you a number and amaze you a little bit too, there are 1,000 applicants on the US side. They matched into US residency program. There were probably 1,500 to 2,000 who applied in the match. And each candidate probably needs about 4 to 5 observership or clinical experience opportunities. So that numbers could go up to 8,000 or 6,000, which is huge. And if you look at the YPC pool, they only have 15 to 20 preceptors in the YPC pool. So we're not going to be able to care those needs unless we get more preceptors. So for folks who are listening here, please become a preceptor under APPNA YPC so we can, provide those opportunities. I gave a long-winded answer. I don't think yes, there is an effort on the way, but we all, as members, as someone who are passionate about residency applicants, younger physicians, we all have to participate in that. But work is under the way. Now, I don't know much about Canada because, I'm sort of naive, and that's where, Dr. Sarah Makhtoom, Dr. Fiza Rafiq, and other colleagues can answer that question.
No, thank you so much. I have Dr. Sarah Makhdoom joining the session. She's the chair of YPC Canada Committee. Sarah, if you have any short answer to this question, we can have a separate session with YPC committee as well, and talk to the chairs of both Canadian and USA chairs for YPC committee to throw more light on it. Sarah, if you have 1 or 2 minutes to talk about this briefly.
Assalamu alaikum, Fiza. Sorry, could you repeat that question?
The question is how we can get involved our medical students and international medical graduates into research opportunities in USA and Canada.
So I have been getting a lot of questions from IMGs in Canada about this, and I've actually started gathering all the names, and then hopefully we can get a small group going to discuss opportunities about research in Canada.
Thank
and
you, Sarah.
I will collaborate with the...
Yeah, we will have a separate session on this with YPC committee, inshallah, soon, and then we will have more updates on it.
Yeah.
It's a lot. So I see Saima is highlighting a very important point here, that there's a significant administrative gap in Pakistan. Can we engage non-physicians, especially to address social detriments of health and administrative gaps in Pakistan?
So again, this goes back to, unfortunately, I don't want to say a lot of things in public, but it can be challenging going back home and making a policy impact. So a lot of it happens through leveraging relationships and fostering connections and then making that change happen. So and I think our specialty networks can be really helpful in that, because you develop that professional relationship and you can do that. So for example, Dr. Fiza Gilani in HIV group, she has reached out to ART centers who provided them free of the cost course participation. And then we can talk to folks like people in Health Services Academy and how to trigger the change. On the psychiatry side, we are working with psychiatrists who work on suicide. For example, we just created suicide guidelines back home under Pakistan Psychiatric Research Center. And our goal is to slowly take it to the stakeholders and make that change happen in that way. I think I agree there is a significant gap, but a lot of it's going to happen through fostering those connections. Just telling them that you're doing something wrong, it's not going to work. That's where we can energize our specialty networks, and they can be so much helpful for Merit in advancing the mission of the Merit.
Then we can ask the last question.
Yeah. So Michelle is a graduate of Lahore Medical and Dental College, and she's asking about, currently she's applying for psychiatric residency in US, I believe, and she is asking if there is anything APPNA can help with these type of applications and IMG students.
So that's again a YPC question. I would answer that question. So the YPC can provide you guidance and show you the path, but you have to walk that path. So you probably need to speak with someone who you can say that is my mentor, and talk to them what is in your applicant, because I'm a psychiatry program director. I reviewed roughly about 750 application last year. And each application looks different than others. Each have unique strengths and challenges of its own. So you have to see what you can do to improve your resume. I cannot, a blanket advice would not work with that, for those folks. I think YPC is going to do personal statement and ERAS CV review. They will do mock interviews, so take full advantage of those opportunities. Also, I think, where one thing that I've seen is, besides the USMLE scores, where our candidates struggle with is that's the communication skills. That's how they appear in interviews. I think focus more on interviews and how can you improve your communication skills. Best way is to just get out of your house. If you're in an area where there are festivals, just go there, talk to people, and try to connect with people. Let's say, and this will help you in a way, because let's say if you are in a Zoom interview session for a residency position, and there is a small time, like 2 minutes, and you have to talk to someone, you should be able to talk about something, and you will get to know when you will get out of your houses and talk to people who look other than like me. So that Caucasian population, the cultural talk, learn about the supports if you can. So that's my long-winded answer for your couple of liner question. There was another question that was deleted. I was hoping to answer that question too.
I think it was
Can I take on that question?
Yeah, I think it was from Michelle, and she wrote it again. That was for graduate of Lahore Medical and Dental College, and that question came up. Um, I would like to acknowledge Dr. Nushad Nurani has joined us. He's also a psychiatrist. He's the he's the president of APPNA Ontario chapter, working as a psychiatrist in Toronto area in Ontario. Welcome, Dr. Nurani. If you have any questions, you can unmute yourself and ask the questions.
Assalamu alaikum. Thank you very much. Actually, I'm on call, but I just logged in, so I missed the whole presentation. I heard just one question recently. So I don't know what's happening, but if anybody has any question that I can answer, I'll be happy to do that.
I think Dr. Nadeem Azhar has asked the question to Dr. Sadiq Naveed that how can Canadian physicians get involved in preparing a course or can get involved in teaching opportunities. Um, so Dr. Naveed has offered that all Canadian physicians who want to work with APPNA Merit, want to teach, they can get involved. And Dr. Sara Maktoum is making a list of all those preceptors and teachers who are ready to provide mentorship in Canada to international medical graduates. I think that is the biggest question of this forum today is how to get involved in research, how to get opportunities for observerships in Canada and USA. And if you can throw some light on that, being working as a psychiatrist in Ontario area, if you have any suggestions and advice for us.
Thank you. Yeah, so getting involved in the healthcare system in Canada is not easy, as you know. That is a little bit discouraging. I also got my training from USA. And in USA, I think there are more opportunities as compared to Canada. Canada has more strict restrictions here. Even somebody wants to do some observership here. I work in a hospital setting, and it's very strict here to allow anybody to do the shadowing or observership. Unless you are in a private practice, then you can do it. And most of the psychiatrists working in Ontario and actually throughout the Canada, they usually are connected with the hospitals, except a few who are doing private practice. So it is very difficult to get somebody into hospital shadowing system. Now, research opportunities are also very limited. I am not into research, but there are people who time to time help us. I know Dr. Akhtar Hamid here in Ontario. He's involved in research and he helps many of the IMGs to get involved into the research programs. Yeah, and through YPC, Dr. Sarah Maktoum is doing a great job. She's prepared, I think, a list of preceptors accepting patients for shadowing and observership. So I think that may help. I have not written my name because I cannot do it because I'm working in the hospital setting, and it is very difficult to do that. But people who have some luxury to do that, they are participating and they have given their names. And I saw the list, and it's really good. And then also she's including the names of IMGs who are interested in those kind of programs, research or observership. So that will help.
Thank you so much. Thank you so much. Dr. Tabani, if you have any questions, Dr. Tabani is the General Secretary of APPNA Alberta chapter. You have any questions? Go ahead, please. Dr. Tabani is mute. Dr. Zahid Rafiq is here. I think he has worked with APPNA Family Medicine, APPNA Merit Family Medicine Committee for the past few years. If anyone has any questions before we can finish our webinar,
Yes,
please.
there is a question in the chat box for that Dr. Zahid might be able to help from Syed Arsalan Ali about practice pathway for internationally trained physician in Canada. And can we engage internationally trained family medicine residents to expect system and practice differences and what to expect while entering? So, Syed Arsalan, if you are there and you want to ask this question.
Hi, Assalamu alaikum, everyone.
Walaikum salam.
Yeah, so I'm one of the physicians who actually entered practice pathway in Canada over almost 2 years now. And this is a question that always, a lot of people ask and come to my mind as well, because when we're entering, because I did my training from Pakistan, and I essentially do not have a lot of experience in Canada that I obtained afterwards. But I was just wondering, when someone is in the process to get the license and they are actually training, maybe there's some sort of guided session or course we can make that can educate students and residents to kind of what to expect and how they can prepare when they are coming to incorporate in the system, and what are the differences among the practice in Pakistan and Canadian system that we expect, kind of an overview and some guidance about that.
Uh, Thank you so much, Arslan. And many of us have been involved in these kind of training, providing training to all those international medical graduates who are coming through practice readiness assessment pathways. And you're extremely right that many of them who have come here, they're not familiar with the system here, and they need to learn it before they go for their supervised assessment and all those things. So it will be great if we can create some online, I think, small sessions or training sessions, and let them know what to expect when they come here. That'll be a great idea. And I think APPNA Merit or APPNA YPC committee, through APPNA YPC and APPNA Merit committee, we can certainly create those small little courses. We have done that before in 2021, 2022. There was a family medicine course that took 1 year, and there were weekly sessions. We were all involved in that, and we have provided that sessions to GPs in Pakistan. And I think we can repeat that through APPNA Merit to provide online courses, what to expect in USA and Canada, and to let them know what are the expectations, and that can be restarted through APPNA Merit. I can request Dr. Sadiq Naveed, Dr. Saad Usmani to please restart that program, because we are mostly family physicians here in Canada. So and our goal is to empower Pakistani physicians. And now Canada has a different pathway where they can get training in Pakistan and can come here without doing residency. They can start working here, which is called practice readiness assessment. So we need to focus more on family medicine. We need to empower not only family medicine in Canada or USA, but also in Pakistan. Primary care is the foundation of our medical field. So this is something that we should focus more and more, and we should maybe restart this recourse, which can be very helpful for everyone.
Thank you very much. And I think, APPNA Merit platform, APPNA Academy platform is available to you as your platform. So I hope that there are, let's see if there are 2 at least courses coming after this. So we are there for you. APPNA has a YouTube channel. A lot of things can be shared too. It's an excellent idea to have these resources readily available to everyone, and so everyone can benefit from them.
Thank you. There's another question. This is not a popular topic, but when it comes to advocacy in Pakistan, has APPNA thought about medical students in medical school with disabilities, visual, motor, etc.? Unfortunately, in Pakistan, there is no concept of enabling disabled students.
So I think, that's it becomes tricky when, the individual medical schools get involved. What we can do is we can have that conversation, get started, have a webinar on this, and talk about possible disabilities in medical student, at least get the dialogue started. And also, I think it also normalized that it's okay to have some disabilities even when you are a highly accomplished medical student. Thank you for the suggestion. I will certainly think about that and see what we can do. Being a child and adolescent psychiatrist, this is pretty close to my heart.
Great. Great suggestions, great advices, and thank you so much, everyone, for joining. It's always a pleasure to have a group of physicians and students and international medical graduates who just get involved in teaching opportunities and helping each other. A great platform of APPNA. Thank you, Dr. Sadiq Naveed, for joining us and giving your valuable input. Thank you, everyone who has joined and asked valuable questions. We will all need to stay connected, stay together for more opportunities and for more programs. And we'll come back with another session, maybe with YPC committee next time, and explore more about it. Thanks a lot and have a great weekend.
Thanks, everyone.
Thank you. Have a good day.
Thank you.